Okay, well, as a chief nurse, I'm here because I want to hear what patients are saying, what's important to them, and the only way we can really influence change is by meeting their needs. But as a mum and a grandmother and a wife and a daughter, actually I'm also a service user, so for me this is really, really important. It's about listening. Technology is really, really important because actually what it can do is give the patients real ownership of their own diseases or of their own health, and it can also give them confidence in managing their health at home. So for me, if we can get every part, from patient understanding what they can do, right the way through to each part of the health service getting it right using technology, we can make it so much better for patients.
I work for Cumbria Partnership Foundation Trust. I'm a quality improvement lead for children's services or children families care group, and so really I was interested in the transition workshop because I'm doing a lot of work on that at the moment, and I'm really interested in having conversations with all the different disciplines that are here. Always challenging, but I think it's very important that all the different people come together to have these discussions. We need engagement of all different organisations and the public to make decisions and help us move forward.
Well, I knew about it because I follow a couple of people that's been organising this on Twitter, and just the title got me intrigued. So I became curious to see if patients really had a say in conversations like this, and so far it's been worth it. So I took a bit of a gamble really. I was even thinking yesterday, was it worth paying my own petrol and coming up to see a bunch of professionals talk about stuff? But yeah, it's been quite interesting and I've felt part of it.
It's been great. Go to lots of meetings in this role, and it's been really good to be at one with such energy and engagement from such a wide range of people. There's been a lot of energy in the discussions that we've had. We've had 4 discussions, same topic, 40 minutes each, but each group has gone over. There's been a lot of energy and ideas in the room. Challenge, turn that into actions, and I know there's a real willingness and commitment to do that. And I think from some of the comments earlier, we need to start breaking a few rules and pushing the boundaries to make change happen.
When you say something as extreme as that, what do you mean by it?
I think the frustration that has come across from the discussion is we've got some great services, but a lot of those services have boundaries around them. They're designed for people with particular conditions or in particular geographies, and there's a real frustration that they're not meeting the joined up needs of the people that live in the communities in Cumbria, and a real desire to sort of break some of those boundaries, break the rules if you like, and start joining things up around what people really need. Clearly there are risks in that, and I think people are not going to get rid of the rules completely, but there's some real enthusiasm and frustration from not just the people using the services, but the people who actually work within them feel frustrated that they can't do the right thing for the people they're trying to serve.
I think today has been fantastic to hear all the different perspectives. We've heard clinical perspectives, health and social care and patient views, and bringing those all together has been really valuable to think how we move on from here. So personally for me, I want to get some sort of action plan of what we can take from today, of some quick wins, some medium-term wins and longer-term planning, and build that into all of our organisational plans across the Alliance.
Feeling pleased, and I would say I'm chuffed to bits really. It's far exceeded my expectations, been absolutely well received, and throughout the organisation have been very well supported, been delivered perfectly. We have had fantastic input from service users, from people who provide services, and been a real enthusiasm, and we can see the energy that people really want to be in control, and also there's a real passion in the health profession that we want to help people take control of their own illnesses. So I'm very well pleased with the way things have planned out. Fantastic. So can't ask for anything more. Brilliant.
How have you managed to get such a high calibre of speaker? Because there's some people that have travelled the length and breadth of the country to come and be part of this event.
Well, it's really about, people come for what the event is about. It's not about me or it's not about, Cumbria. It's about doing the right things, and people will travel doing the right for the right reasons and doing the right thing. You can imagine Kath Evans, who's a national lead for patient experience in children and young adults, was invited to 10 Downing Street, and she actually came here. So how important is that for her to actually come here and be a part of this conference and to help us shape the best healthcare system in Cumbria? So it's all about the message, the passion people have in Cumbria, and the sense of community and the motivation that we want to be the best healthcare system. They wanted to be the part of that movement, and I'm sure they will continue to be the part of that movement.